Force on Aging to order for Wednesday, May 22nd, 2024. I would like to make a change in the agenda order. We have Pennsylvania online today, and they have to have a hard stop so that they can go meet with their governor. Is Mark Dagley in the room? Mr. Dagley, if it's all right with you, we would like to move you after the presentation. Wonderful. Thank you so much. I appreciate your help in this regard. While there are only two of us of the task force present in person, the other members are online because of the date change that we had to make to accommodate the legislature this year. So there is a quorum present. And with that, the first item that we have is the approval of the April 2024 minutes. And I would ask if there is any discussion to the minutes. Any discussion online? Seeing no discussion on the minutes, we will move to adopt the April 2024 minutes. Because we're online, I think we need to do a roll call vote. So as chair, I say aye for the adoption.
Aye.
Dr. Gogler?
Yeah, aye.
Representative Zalesnikar? I think that was aye. Representative Zalesnikar? You might be muted. Councilwoman Armstrong?
Aye.
Senator Housley?
Aye.
Ms. Foley?
Aye.
Representative Zalesnikar? She might join. That's 6 ayes, though.
We have 6 ayes. Are there any nays? Seeing none, the minutes are adopted. Our next item on the agenda will go to the presentation by the Pennsylvania Department of Aging. They are online, is that correct, Mr. George? Okay. When you are ready, if you will please state your name for the record and begin your presentation.
Sounds good. Thank you. Thank you so much for having me. My name is Gabrielle Szymanski, and I'm the Executive Director of the Pennsylvania Council on Aging, and I will hand it off to my colleagues to introduce themselves for the record as well.
Thank you.
Nathan Lampenfeld. I'm Pennsylvania Department of Aging's William and Hannah Penn Fellow. Jesse.
Hi, everyone. My name is Jessie Pierce. I am the Executive Assistant to the Secretary of Aging, supporting the Aging Our Way team and other developments in the department. Nice to be here.
Thank you so much. Andrew, should I go ahead and share my screen?
Yes, please. Thank you.
All right. And can everybody see this okay?
We cannot see your presentation.
All right. Not letting me go into presenter mode, but I wanted to first talk about what we're going to be going over today. We're so thankful to have this opportunity to talk to you all and to learn both from you.
Can you hold one moment? We are having a technical difficulty here.
Sure.
Thank you very much. Please begin.
Good. All right. So today we're going to be going over a little bit of our background with the department, and then going into kind of current priorities for the department with our strategic outlook over the next 10 years with our multi-sector plan for aging, which is now known as Aging Our Way. So a little bit about the department. PDA is a relatively older Department of Aging across the nation and was started in 1978 by Governor Milton Schaap. When he established the PA lottery system in that same year, he decided that the revenue from the lottery program should actually go directly to older adults. And that was kind of the start of the Department of Aging. We actually, at the department, we have someone that has been working in state government and at the Department of Aging since its creation in 1978. So we would be happy to connect you with him. He has a lot of great insight, background, and just stories to share. If you are ever interested in kind of learning more about that creation process, we'd be happy to connect you there. But when it was created in statute, they described the PDA mission as to promote independence, purpose, and well-being in the lives of older adults through advocacy, service, and protection. So this is a little bit different than kind of what our sister agencies, which consist of the Department of Human Services, the Department of Health, and the Department of Drug and Alcohol, because we are truly charged with an advocacy measure and making sure that older adults have the services that not only they need, but that they crave in their communities as well. So this is a little bit of the current snapshot of Pennsylvania. Pennsylvania population is about 13 million, and 3.4 million there are 3.4 million older adults that are over the age of 65. So this is the 5th highest population of older adults in the nation. And it's currently about 1 in 4, and it's projected to grow to 1 in 3 will be over the age of 60 by 2030. Another statistic that we normally like to talk about here is that not only is the older adult population getting larger, but the oldest of the olds, as we say, is also growing exponentially, so that 85 plus. And as you all know, as we know, with aging also comes an increase with disability normally, with about 45% of people over the age of, I believe, 70 aging into a disability. So a few factors going on that we want to account for now with this growing population and make sure that our service infrastructure is ready for that influx. Our current annual budget. So as I said earlier, unlike other states, the lottery in Pennsylvania is our main source of funding. So our current annual budget is about $600 million, which is, I know, much larger than a few of our other counterpart states that have a similar older adult population. But that is because 80% of our state funding comes from the lottery and supplements our 20% federal funding that goes directly to our older adults. Our OAA programs and services, Older Americans Act programs and services. So both of those things together are used for older adult services. And our current complement of the Department of Aging is 90, and that has stayed pretty consistent over the past decade. But this does not include kind of our consultants that we bring in for special projects, academic partnerships, and the interagency work groups. I know Nathan, myself, and Jesse all sit on different interagency work groups that are kind of going on across the Commonwealth. And this is not only our sister agencies, our health hub, as we say, but this is our DCNR partnerships for older adult access to the outdoors. This is DCD, economic development. This is truly across the board. We kind of sit on these interagency work groups to try to make sure that these services are holistic in our approach. And this is a picture of our current organizational structure. And I wanted to include this for all of you because it helps really understand kind of where our resources are going. So at the very top, we do have the secretary, and he works directly with our governor's office and between their policy office, their legislative office, and their communications office. So we have a lot of open communication with them, which is great. And then under our secretary, we have our deputy secretary of aging, who takes on a lot of the, what we kind of say is our day-to-day, our Bureau of Aging Services, which deals with housing and community services, and our OAA programs and services. So Senior Community Center grant, Senior Community Center, our congregate meal programs. Our deputy secretary also is heavily involved with our Bureau of Quality Assurance. So this is all of the data that comes into the department from our AAAs. So something I'll talk a little bit about later is kind of our aging network. And we have, unlike other states, we have a large number of AAAs across the state. So Pennsylvania has 67 counties, but we have 52 area agencies on aging, which can be really, really great for reaching our community members because they actually have a physical office to go to, but there's also challenges there as well. So this is just a snapshot of our organizational structure. So I kind of want to go over some of the opportunities and challenges that we face as a department, having a secretary, having a cabinet level department within or agency within Pennsylvania. So some of our opportunities are a really established pathway for communication to the governor's office. We have been working really closely in the past few months to get Aging Our Way, PA, across the finish line. And part of that is this like really critical open communication with our partners in the governor's office. So like you heard earlier, being right after this with our governor's office counterparts to go over that kickoff meeting. So this is really important and allows us to kind of push what we've been hearing from older adults themselves. Another opportunity is specified funding for all older adults, both Medicaid eligible and not Medicaid eligible. So a lot of the programs that are going on at the Department of Human Services, specifically at the Office of Long-Term Living, are specifically for Medicaid eligible, like dual eligible individuals, so Medicaid and Medicare eligible. And so we want to make sure that we are focusing on the older adults who do not have access to Medicaid but still need those type of services. Something that's come out of a lot of the research that we've done this year is that a lot of the older adults that are getting services through the Department of Aging are this near poor population, so that they sit just below or just above the federal poverty line, so that 100 to 150% of the federal poverty line, where they may not qualify for services, but there's still absolutely a need for services, especially with the growth in the cost of living across the nation. So a lot of our efforts have been specifically focused on this proportion of the population, especially because knowing that they may be able to spend down into Medicaid eligibility, and as much as possible, we want to keep them out of that more expensive system and really meet their needs with home and community-based services. Another opportunity is to advocate for supplemental funding specifically for the Aging Network. So this might not just be for the Department of Aging. You know, we can go out and we can say, we need this money to go to older adults, and it might not just be for the Department of Aging, but for our Aging Network as a whole. And finally, the legislative power to set the agenda. Because we have a cabinet level position, we also have somebody dedicated to policy, somebody dedicated to legislative affairs in our office. And in that way, we are able to meet with our legislature. We are able to, we do a House hearing on the budget every year. We anticipate being invited to a Senate hearing on the budget next year, which, you know, in some ways is, it's always a little frightening, but at the same time, it means that this is something that our opportunities are growing and our budget is growing as well. Some of the challenges, as you probably all know, this is pretty common across the board, but there can be siloing when you have different agencies. So something maybe DHS and DOH are both working on projects or programs or whole departments and bureaus that are dedicated to older adults, such as the Office of Long-Term Living. There's an interagency work group on long-term care at the moment out of DOH. And so something that we're really trying to do, and what we've been really, the three of us have been working a lot on over the last 10 months, is making sure that all of our efforts are streamlined. And we're working with our agency partners and not completely separate from. So this is something that I would definitely say is a challenge that we deal with every day. We'll go into meetings and say, this is what we're doing. And they say, oh, we're running a very similar program. And then making sure that we're overlapping and trying to use those funds in a more streamlined manner. Another challenge, I think, for us as a department is that we are one of the smallest agencies along with DDAP. So we only have a complement of 9. I believe DHS has a complement of about 15,000 across the state. So that's a huge, huge difference. And so that kind of limits our legislative and financial power as well. And then, like I said earlier, we do have 50 true AAAs, which is incredible for truly reaching older adults where they live in their communities. But at the same time, it can be really hard. It can be a challenge because you have 52 different area agency on aging directors. You have 52 different priorities coming out And so we're glad that they can prioritize what their community needs, but at the same time, it can be challenging to make sure that everyone is kind of on the same path to the same end goal. Perfect. And here are some of our key entities that we work with every day that are kind of instrumental in the aging network process, that were critical to creating Aging Our Way PA. So in addition to the 52 AAAs in the state, we also have the Pennsylvania Association for Area Agencies on Aging. I would definitely consider them a key entity. I probably talk to people at the association 2 or 3 times a week, at least, at minimum, just to make sure we're all on the same page between the department and our AAA network. Another entity is our Long-Term Care Council. So this is a legislatively appointed body by the governor's office, and then I believe it goes to the Senate for approval, and Jesse can correct me if I'm wrong there. But they are critical. They come from only different agencies, but different stakeholder groups as well. So for example, the Alzheimer's Association, which you can see here, has a seat on that council. So it's really bringing together these different stakeholder groups to make sure that we have conversations continuously with each other. Pennsylvania Council on Aging is that is my department. So it's 21 individuals, of whom at least half have to be over the age of 60. And these are the advocates for the older adults in their communities, but they also tell the department, they tell me, and I share with the secretary exactly what the older adults are saying and what they think that older adults in their communities need. We've had a big push with them for advocacy this year. So advocating for the budget, advocating against House bills that are coming out that we see as, that might be a problem for the department or for older adults themselves later on. So they played a really key role. We've had our biggest ask for investment in aging services this year through our budget process. And so they've been really critical in getting word out about that budget and making sure we're calling our legislators, we are calling who we need to ensure that this budget is getting passed. Some other entities are the Pennsylvania Association of Senior Centers, the Alzheimer's Association, and other external stakeholder groups, AARP, Leading Age, et cetera, and our Centers for Independent Living. I will say that because of the way our funding streams are set up, there is a little bit of a disconnect between our services for individuals with disabilities and for our aging population. So this conversation, this partnership between us and the Centers for Independent Living is something that we are still trying to work on and gain a better partnership there going forward. So that is a little bit just on the background of the department. What I wanted to talk about next is Aging Our Way PA, because it's truly what the department is going to be working on, not only for the next year, but for the next 10 years. That is our 10-year strategic plan. So Aging Our Way PA is the 10-year strategic plan designed to help transform the infrastructure and coordination for services for Pennsylvania's older adults. So this is a living document, so it can change, and we expect it to change over the next 10 years. California was the first to do this and was kind of the blueprint for multi-sector plans across the nation. Unfortunately, they started their project directly before COVID. We kind of have the advantage of doing this after COVID and seeing how the aging network has transformed due to that, and how we can be more responsive to emerging events, to public health crises, to natural disasters as they happen. So I kind of want to talk about why we're doing this and the impetus for it through our governor's office. So this was truly because it was necessary. There needed to be an investment in aging services now. This population is growing and growing at a rapid pace. And when the new governor's administration, Governor Shapiro, came in, one of the campaign points was about older adults and making sure that they have the services that they need to live in their communities. Something that he is really focused on is our property tax rent rebate for older adults who are either low income or close to that low income line. So this was truly started by that governor's office. But in addition to the governor's office, there was a lot of push from our external stakeholders, from AARP, from the Age Friendly Network, our partners at Age Friendly Pittsburgh. So there was a lot of push from those external stakeholders to get this done at the very beginning of the governor's administration and even during the campaign process as well. So this was a completely stakeholder-driven plan. We did over 200 listening sessions across the state, at least one in every county. Like you all, we have some really rural communities, and we were excited that we were able to meet those communities where they were, and in a way that worked for them. We also did virtual listening sessions. We did one for the deaf and hard of hearing community. We did one in Spanish. You know, we were just trying to get everybody and anybody involved in this process, older adults themselves, caregivers, care partners, care providers as well, to make sure that everyone was getting what they needed out of this plan. This was a collaborative process, and we also wanted this to be very achievable. Something that we had a lot of conversations about is, okay, we have these really high and lofty goals, but how can we transform this to actually be something we can implement and track over the next 10 years? We want this to be transparent. We want this to be accountable. And part of that is understanding what's realistic and what's not over the next 10 years. So again, this is just a little bit about that demographic shift. So we talked a little bit about this earlier, but again, this was really the impetus for why we are doing this. From 2010 to 2020, the older adult population grew from 15.4% to 17.8%, and still growing at a rapid rate. So this is a little bit about that background. This was our actual stakeholder engagement numbers. So that qualitative data that I was talking about, we had over 10,000 responses from across the state. We also, in partnership with the University of Pittsburgh, like I said, we do have a lot of academic partnerships going on at the moment. We did a needs assessment survey, and we both did one that was a distributed survey online. And we also did a survey of a random sample of 900 older adults. That was actually a call survey. And then compared those to say, okay, these are the 900 random sample older adults, and these are the older adults that we reached from our online survey responses. And what are the differences about what they are saying in response to these questions? And what can that tell us about who we are reaching and who we are not reaching? So that was something that was really important for the development of our goals and our strategies outlined in the plan. And that had nearly 8,000 responses. Our public comment engagement over online, from email, or physical mail, voice mails, we had over 800 responses. I still have a stack of letters, just sitting in my office that we've opened and had to transcribe. And so this next slide is a little bit about our priority strategies and tactics. And I'm actually going to hand it off to Nathan from the department, who was our main writer of the plan.
Thanks, Gabby. Yes, so as Gabby had mentioned, it's sort of structured in priorities, which are our high-level themes that we heard through our listening tours, the strategies, which are sort of how we're approaching these problems and what we hope to move the needle towards, and then tactics, which are specific and measurable actions and what we will actually be the achievable aspect of the plan. So our 5 priorities are unlocking access, aging in community, gateways to independence, caregiver supports, and education and navigation. Unlocking access is really about ensuring that all of our older adult population, the most marginalized, most diverse group, are able to equitably access the services that they need when they need them. Aging in community is primarily about housing, and that's safe, secure, and affordable housing, as well as maintaining older adults' ability to interact and involve and engage with their communities in the way that they see fit. So, community service, volunteering, work, things like that. Gateways to Independence is primarily about transportation, whether that's active transportation, public transit, other types of getting around to the places that we need to be active and involved community members as we age. caregiver supports is pretty self-explanatory, but this includes both our paid and unpaid caregiver workforce. And we're really working to strengthen how we're supporting, training, providing respite and different navigation tools so that caregivers, which are a substantial part of our population, are able to continue doing the work that they do. And then finally, we have education and navigation, which is really about making our services more visible, our access points more visible, and then streamlining how people seek, identify, and activate those types of services. So we're awaiting approval of our final draft. So the tactic numbers are a little bit shifty still, but we have over 160 tactics that we want to include that fall into these five big priorities. Gabby, if you want to go to the next slide.
And that's actually it from
That's it,
us.
okay.
Any questions? We are happy to take those now. Anything at all. But thank you so much for having us.
I want to be respectful of your time. So let's go first to our online members of the task force to see what questions they may have for you. Dr. Gogler.
Yes, thank you so much, State of Pennsylvania, for joining us here today. We really appreciate it. My name is Joe Gogler. I direct the Center for Healthy Aging and Innovation at the University of Minnesota here in the School of Public Health. And I was intrigued when you had mentioned academic partnerships, and I wanted to know a little bit more about the types of academic partnerships that your office has established with, for example, the University of Pittsburgh and others. I know some states actually have a formal appropriation to some centers on aging in their states to support and advance some of the work of their respective offices, but it appears to me that your partnerships are more based on a project-by-project basis. Could you tell us more, please?
Yes, so that's pretty correct, is that we go project by project. I think Nathan wanted to interject there.
Yeah, I just wanted, so we do a lot of leads for, we'll work on specific program evaluations with the University of Pittsburgh. There's a couple projects we have with University of Pennsylvania. And then we work a lot with our state data center at the Penn State University. Those are our main big universities. We have some training and education with Temple University. So we try to reach different areas across the state with our academic partners. But we are hoping, as part of one of our tactics and our proposed budget ask, is to establish a more focused ongoing project to establish sort of an evaluation center within the University of Pittsburgh, or some academic, however that is, where we can continue to go project by project basis, but we have more of a holistic evaluation of Aging Our Way, as well as our larger aging services, just so that we can ensure, that it's equitably accessible, a big component of this project, and that these services are actually high quality and effective, and all those important metrics that we want to achieve.
And kind of from a systems standpoint, we do normally have to go through a procurement process with the state. So for any new, I believe like the newer programs that are coming out of this would have to go to the procurement process for vendor registration, and there'd have to be competitive bids out. Normally, sometimes if there's an ongoing project, if you can attach to a new statement of work, we can do it that way.
Dr. Gogler, did you have a follow-up?
No, that's very helpful. I think one thing I would ask the committee to do as we start reflecting on our final report and the recommendations in it is, a point I've emphasized very strongly, and perhaps those of my colleagues in Pennsylvania can sympathize, is the importance of any recommendations we make should also include a very strong plan for tracking implementation and implementation success, et cetera. And in reflecting on different state models, I know of multiple states that include in state appropriation budgeting support for centers on aging to do such work. And it is something I would like us as a task force to consider.
Dr. Gogler, I agree wholeheartedly. I think we have to be data-driven on what is successful and what is not successful. And I think this this evaluation process that we just heard in looking at who those vendors, approved vendors would be to do this is something that we need to think about, making recommendations as to who those individuals or entities might be for getting that high-quality, transparent data. Because and when I was reading the Pennsylvania plan, it looked to me that data is something that is a major focus. And maybe Gabby, if you want to address that? Or
Sure,
Nathan?
yeah. Data was something that we definitely had a huge focus on. You know, we wanted this to come directly from the stakeholders, but also we will be publishing all of the public comments. That's something Nathan and Jesse have been working on this week, is to make sure that there's no identifiable data. But this is going to be a transparent process. People can see exactly what people wrote and where these recommendations that are included in the report came from. Jesse or Nathan, do you have anything to add there?
Yeah, I'll also say to the point of, our whole sort of argument for this plan is that these preventative services, these home and community-based services, are less costly and more effective. And we really need a way to capture the data that can help us demonstrate our return on investment and showing that people aren't spending down to Medicaid, we're not spending more on Medicaid funding to support services, and that people feel more empowered to remain in their communities, to continue, being able to work, being able to volunteer, being able to maintain their community connections. So that ROI piece is something that we really want to focus on the evaluation and the data aspect. So is something front of mind for us.
Okay. Representative Zalesnikar.
Thank you, and thank you for the presentation. I appreciate it. And it was interesting to me when I looked at the difference between Pennsylvania and Minnesota. We have very similar populations for senior in the percentage of the total, and the distance across the state is about the same, 300 miles for Pennsylvania east to west and 358 miles east to west. And so, greater Minnesota has the largest, the rural areas, and I know Pennsylvania has rural areas too. And I guess my question is, when you've looked at the community interaction model, because I believe that's an integral part to avoid isolation for seniors at home, have you had any success integrating childcare programs in your state? That type of, or I know you've done things with the universities, but my question is intergenerational programming with childcare.
I'm not sure specifically on childcare.
I would just like to say this is Gabby speaking. Please go ahead.
Sorry, yes. We do a lot with grandparents raising grandchildren. That's been a heavy focus of ours over the last couple of years at the department. Jesse wrote a really big report on kind of the big focuses of the department over the past year. Jesse, do you know anything about childcare specifically? Nothing comes to mind for me.
We don't have, one of the policy initiatives in Aging Our Way is to increase focus and increase partnerships with our Bureau of Children and Youth at our Department of Human Services to increase those possibilities and to make sure that we are supporting grandparents raising grandchildren. So that's a really promising thing that's coming. As far as dedicated as dedicated program structure, I think it's more incidental at this point, but our intention is to, we know this is happening, we want to invest in it.
Okay, and I saw in your report that there was I think the word multi-generational was used a significant number of times. Is that correct?
Yes, both multi-generational and intergenerational. We see it as, imperative for the aging process to be succcessful.
All right. Thank you.
Nathan, any comment on that?
Yeah, just to add, so there's, it's a lot, like Jesse has mentioned, there's a lot of those implicit effects that we don't necessarily have.
Okay, we have lost Nathan for just a moment.
Yeah.
The focus is keeping people in community. when they're in community, they're able to be caregivers, mentors that aren't as formalized, but are, critical to making sure people have those types of connections and, they feel belonged, and, members of their community. I don't know. It says my internet's stable, so I don't know if I skipped off.
Okay, if we continue to have trouble, Nathan, we'll just ask you to turn off your camera when you speak so that the connection will be a little better. Okay, Representative Selesnikar, did you have a follow-up?
No, thank you.
All right, thank you very much. Is there anyone else online?
This is Jen Foley. I did have a question,
Please go ahead, Ms. Foley.
if I could.
Yes, please
I
go
didn't know how
ahead.
to do the raise my hand and the.
You're doing just fine. Okay, go right ahead.
In your listening sessions, it said you had over 200. Was there a recurring theme that popped up in any of the listening sessions that people wanted, or anything that surprised you in the comments that you weren't expecting? I was just kind of wondering of that.
Yeah, so a lot of recurring themes. We actually used qualitative thematic analysis to review the data. That was Kevin Hancock, who was previously with the department, and kind of, our leader on this project, just recently retired. Nathan and I did that analysis back in October. So a lot of recurring themes, but I think something that's really surprised, me was how intersectional truly all the domains of the age-friendly framework are. So we used the age-friendly domains of livability that was adapted by AARP for the US, but created by the World Health Organization. So for example, we were in Philadelphia, and a woman was talking about the potholes in Philly. If you ever driven through Philly, you will totally understand this, but she was in a wheelchair and she couldn't cross her street because of these huge potholes that were in the actual crosswalk area. So because she couldn't get out of her house and go across the street to her local grocery store, she suffered from higher levels of social isolation. So less social participation. So everything truly is very much intersectional with the aging process. Nathan, did you want to talk a little bit about our major themes?
Yeah, so the major themes sort of get, the big things become the priorities, and then the strategies are sort of our themes that we heard and sort of where we want to address people's concerns. I guess the most surprising one to me was, I am always very focused on navigation and how people access services and find out about services, but it was surprising to me how much people were more reliant on physical types of, so many people mentioned having a phone book to be able to access services and to find them, where, I'm a little more focused on digital and, calling and things like that. But so many people have mentioned that they just want a phone book to be able to find who to call for a specific type of service. That's sort of was one of the surprising things to me, but it does make sense. I think another really interesting one was how much people wanted to volunteer, but they don't always feel like they have value to bring, even though they, a lifetime of experience of older adults have. They don't necessarily see. There's a lot of more implicit ageism that people don't identify with, but sort of elicits those types of feelings like, oh well, I don't really have much to contribute. It really brought out how much we need to reframe aging and how we need to make sure that the conversations we have about older adults and their value that they bring to our communities changes in the next 10 years.
Ms. Foley, did you have a follow-up?
You brought up the phone book, and people are, not everybody has devices. Was that the biggest problem, or people just want a physical hand phone book? Do they have devices?
There's a couple things. There's people that don't have devices, can't afford them, can't afford the broadband, or their broadband just doesn't make it to their area. But also a lot of people that, did feel comfortable using devices, like on a technical standpoint, were really uncomfortable with how much they felt targeted for scams or misinformation. And so, there were a lot of people that are like, I know how to use my phone to do this, this, and that, but I really don't like getting a robocall all the time, and I don't really trust getting different emails. So I'd rather have a phone book. It's more, we try to really focus on preferences and that rather than sort of trying to, more person-centered preferences rather than, what's easier for the department to do or any more achievable project. And so, yeah, I think it was a bit of a mix of why people wanted those physical resources, but that's sort of the ultimate effect.
Yeah.
Okay, and then,
Oh, sorry. I was just going off of Nathan's point. I think the unifying sentiment behind anyone, regardless of reason, is what we got was that they want information they can trust, sources of information that they trust. So
that was my next question, because you have 52 AAA offices, and then you put up the flow chart with the cabinet member, and then you had all the different departments. Are all the departments listed, so if somebody actually has a question, they would know which department or who they're supposed to call to get an answer? Because I've been having some listening sessions myself, and I keep getting recurring themes about, we call this person, and then we get sent to this person, then we get sent to this person, and we don't know who we're supposed to be contacting. So I was just wondering how you handle that. Or if you
Yes.
heard that as a recurring theme in your
Definitely
listening
heard that as
sessions.
a recurring theme, for sure, is, I call them and then they tell me to call this person. And I think that happens across all levels of state government, across the board. Our AAAs are really the point of contact. And we're also trying to expand our PA Link program, which is our ADRC. And so that piece of navigation is where we are hoping to stop that from happening, to say this is the one number you can call, and they tell you and do a warm handoff, a warm referral system to the correct person. But that is something that's definitely repeatedly.
Thank you.
All right.
I have no more follow-up questions at this time.
Thank you, Ms. Foley. Anyone else online? Ms. Schneider?
Thank you, Madam Chair. And thank you, colleagues in Aging in Pennsylvania, for your interesting and insightful presentation. I have several questions. I will depend on Chair Claiborne to tell me when time is up.
Please go forward, Ms. Schneider.
Thank you. First of all, I had a question about your lottery funding. How long has your lottery been in existence in the state?
Since 1978.
Thank you. That's good. If we can keep on like that, I won't run out of time.
Okay.
Second, this probably goes to Nathan because of what he's already shared with us. On your access and awareness, and you talked about your 52 area agencies on aging, and I'm assuming that they do part of the information and assistance. My question is, on a statewide basis, how do you have a helpline? What other forms of awareness building do you utilize?
Yeah, so as Gabby alluded to, we have the PA Link hotline. So there's a few hotlines. There's our protective service helpline that we're working on that is more, I'm in a dangerous situation and I need help. We have the PA Link, which is sort of designed as, if you need resources, here's where to call. And then we have our pharmaceutical assistance line where people will, have more specific program questions. And then each AAA has their own phone number and each own name and own email. So it's very difficult. And the PA Medi line, so if you need benefits counseling. It's all very difficult for someone who is trying to do this for the first time and is generally that situation, someone is in a crisis or needs assistance very quickly. So one of my big focuses is on this PA Link and how we're making ourselves more visible as a network of aging resources, and that the person who calls isn't told, we don't do that here, we can't help you, you need to call this line. So it's really about, the project is going to be about making sure that the consumer journey is a lot more direct and not, the winding, frustrating, exhausting path that a lot of people describe and feel at present. And to boot, those numbers are 1-800 something. They're very hard. No one knows the actual number. Even our experts that we had on our steering committee were like, well, I'm not sure what the number is, but I know that there's the PA Link number, something like that. So it's definitely a primary focus, because my personal feeling is that if someone doesn't know where to access service, we can't get them at least on a wait list and demonstrate how much of a need there is for other services. So that's sort of my motivator. I don't know if that answered correctly.
Yes, thank you, Nathan. Then I have a question regarding your key entities slide. I didn't notice, and maybe this is part of the stakeholder groups, but do you have mental health representation?
Yes, we do have somebody on the council that represents the behavioral health. We also have DDAP on our council, and we also, the secretary sits on the behavioral health council himself, and I'm his designee on that council as well. So a lot of overlap with behavioral health services.
Thank you.
I'll also
And-
say,
Go ahead, excuse me.
sorry, just that we do have, so because there's such a trend in behavioral health and such a desperate need, the Association for AAA's P4A actually employed a behavioral health specialist who's been an incredible asset in sort of educating us on, sort of lived experiences with behavioral health needs, and also really helping with technical assistance with the AAAs. So she's been, Lynn Cooper, she's been a very great resource and an expert.
Thank you, Nathan. And thinking about your awareness efforts and the technology and so forth, and still people are telling you in listening sessions that they'd like to have a handwritten or printed document. Very interesting. And then finally, I'd just like to know about your Medicaid population. How do they receive their health care services? Are you contracted through managed care entities, other health care systems? Could you just say a little bit about the funding for the Medicaid services, please?
Yeah, so I don't want to talk, I don't want to overstep here, because that is the Department of Human Services. So that is not through us, but it is through managed care. And that is how the Medicaid system works. As for specifically for older adults, that is our Office of Long-Term Living under DHS. And I'm sure they would also be happy to speak with you if you did have other questions, and I would be happy to get you in touch with them. But I just don't want to overstep, my boundaries.
Thank you, Gabby. Madam Chair, that concludes my questions.
Thank you very much. And then I just have a few questions myself, and I know we want to get you out of here in 5 minutes, so I will be very brief. One of the things that I was fascinated by is that everyone over the age of 65 in Pennsylvania has free transportation. Would you say something about that, please?
Yes, so that is the goal, right? That's what we try to do. Does it necessarily always work? No, especially in our more rural communities. We are having, one of our biggest problems is just the workforce shortage. There's not enough physical bus drivers. There's problems with the bus services, with routes. The buses won't cross county lines. But one of our programs is to offer door-to-door service for older adults. It's something that we are trying to work on every single day, both within the department and with our partners at the Department of Transportation. We definitely see it from a person-centered approach, and they definitely see it from how the roads work. So this is something that we're learning to deal with as we go. Is we just view the world very differently as departments, and trying to meet in the middle to both make sure the engineering side works and the human side works. Jesse or Nathan, any comments there on the transportation services?
No, I definitely agree with your assessment where they're eligible on paper, but the actual access to the services is, again, one of those things that isn't really working to people's standards, preferences, and needs in the actual communities.
Yeah, it's a very difficult thing for us in Minnesota, and I know it's the number one thing that we hear about the most. The other thing I want to get to is, from your experience, getting to that cabinet level agency, right, and the establishment of that. Can you please just say a little bit more about how you were able to get into that cabinet level position? I think it's something that we need to really be thinking about from a budgetary perspective and as a legislative advocacy. Can you tell us a little bit about the hurdles and the benefits of that cabinet level position?
Yes, so the actual impetus and creation, I don't know if any of us can speak to a little before our time in 1978, but I know that with the creation of that from Governor Milton Chap, I tried to do a little bit of research about why this happened the way that it did. And I think one of the answers is truly that it was kind of a trend going on at the time across the nation, is like other states were doing this. We have a saying that Pennsylvania is not always the first to do something, but we often do it really fast, which we saw with Aging Our Way and with the creation of the department. We were not the first in the nation, but we were one of the fastest to actually get it approved and done and implemented. And I know for us, just having the secretary be that point of contact for the governor's office. He has calls with a deputy chief of staff in the governor's office at least a couple times a week. And having that relationship is so vitally important to make sure that, older adults are not left behind, that older adults are getting the funding and services that they need, and keeping older adults really top of mind. I think we've been really lucky with the governor's administration this past year, and we really keep hoping to keep that really.
Yeah. Okay, so one of the things that I've noticed as the chair of state and local government is that just seeing the need for collaboration across the agencies, right? In Minnesota, we have so much through DHS, and I'm sure you have the same in Pennsylvania. But I saw in our housing policy the importance of making sure that older adults are front and center when we think about what buildings we need to build and how that needs to happen, and in transportation and in metropolitan planning. That coordination, and I kept seeing it in your report, the collaboration, and the stakeholder voice, making sure that the stakeholder voice, and when I say stakeholder, I'm talking about older Pennsylvanians, how critical that was to the development of your plan. Can you please speak just really quickly about partnerships with the private sector and how you see integration of that in your plan?
Sure. So like you said, keeping the older adult lens front and center. We had advocates from both the public and the private sector kind of reminding us of that throughout this process. Older adults might need different design of their houses. They need different design of the transportation system. So just continuously using that lens and hearing from advocates. But specifically on the private sector, Nathan, do you want to talk about that with the plan a little bit?
Sure. I can say that we as the Department of Aging, as the Pennsylvania Commonwealth government, we only can do so much, and we have to work with the private sector, but also we need to change how we're working with them so that we're not seeing, okay, there's a pie this big and I need to get my slice bigger than the other person's. So it needs to be something that's more, we're all working towards the same goal rather than fighting over the same piece of pie. I also think that part of this is we talk about how much the trends and the demographics necessitate this purpose of this plan. They're also going to demand certain preferences. So when we work on the conversation of representing older adults and their needs, talking about universal design, talking about the housing that's adaptive and so that people can maintain their homes or maintain life in their communities. That's also going to, ripple out into the larger community. But it's in making sure that older adults and people with disabilities continue to have a seat at the table in those metropolitan planning organizations and rural planning organizations, and not just in, we have older adults, people with disabilities, we need to have a piece of the housing development for them. It's more about, we're all aging, we all need the same things, we all want the same things, and so more trying to work towards that, human and dignity and respect pieces and preferences, rather than just they are a different population that we need to mold a piece around.
Okay.
I have some to add, if that's okay.
Please.
Okay, so in our stakeholder engagement process, housing and transportation were repeatedly lifted up as being among the most most universally needed and most urgently needed interventions. And both of those sectors are incredibly complex, particularly in Pennsylvania as a Commonwealth. Our local governments and municipalities have a significant amount of sway over how like state policy initiatives, particularly related to land use and planning and things like that, get accomplished or not accomplished. And so so there's a huge variability across the state, which is also an advantage. We have like a tremendous amount of diversity in our communities across the state, but that also presents some challenges at the state level for understanding how these sort of complex and ambitious initiatives related to the built environment are going to be accomplished. And so as we're looking toward both kind of local, like tailoring local approaches, and also toward taking on some of these challenges that are going to require some creative funding paths, we're working really hard on developing public-private partnerships right now we're in the process of framing our age-friendly PA initiative, which is a partnership with AARP and the existing age-friendly communities as offering one pathway for communities to leverage public-private partnerships into effective implementation of some of these more challenging and complex strategies. Yeah. And I will also say the other recommendation that I would have is we have the Department of Community and Economic Development at the state level, and they provide a lot. They are kind of the locus for public-private economic partnerships in the state. They do a lot of grant making, they do a lot of technical assistance, and they also do a lot of technical assistance for local governments and for how to cultivate an effective and productive state-local partnership. So that would be my recommendation as well.
Oh, that's awesome. We have kept you longer than I anticipated. I'm just going to say thank you so much. You have provided us with so much really important material, both to review. I appreciate your being so forthright. It's been very difficult for us to get those opportunity pieces, and you have provided us a lot in that area. So thank you very much. I hope your meeting with the governor is very successful, and we may be in touch again soon. Thank you so much. Have a wonderful day.
Thank you for having us.
Wow, that was really a lot, and I'm excited about that. Next, we are going to move on to the public testimony by Mark Daigle. If you would please come forward. If you'll go to that table there. That way you'll be on camera.
Sure. Should I go to the middle one?
Whichever chair you prefer is awesome.
Oh, okay.
All right. Thank you very much. When you're ready, if you'll state your name for the record and begin your testimony, please.
Sure. My name is Mark Daigle, and I'm a lifelong Minnesota resident and a business innovation manager. For the past 2.5 years, I've been an Uber and a Lyft driver. And when I first began being an Uber and Lyft driver, I didn't anticipate the amount of community building opportunities that I would find. For a bit of a background, I grew up in Grand Rapids, Minnesota, home of the Blandin Foundation. And when I was growing up, there was community support for everything. And it was modeled for us that the highest achievement in business would be to create a successful, profitable, innovative company and then use those funds to help the community. And I grew up thinking that that was normal. And so when I began 2.5 years ago being an Uber and a Lyft driver, I had eyes to see the opportunities to build the community. As a full-time driver, I do about 5,000 trips per year. And so for me, that's 5,000 opportunities to touch base with people in the community. And it's 5,000 opportunities to treat people with the dignity and honor that they deserve simply for being people. And so it's been a treasure. A couple things happened. One, I was honored that through my first 10,000 trips, my riders gave me a cumulative 5.00 customer rating. And normally I actually don't care too much about what other people think about me, but that rating actually meant a lot to me because it came from people from all different backgrounds. It came from people that are Black, white, Native American, Hispanic, Asian, young, old, rich, poor, etc. And so the reason that rating came through is because people can tell when they're treated with honor and dignity. They can tell. And so one of the things that happened, interestingly, last summer, in June of last year, the Star Tribune noticed the community building opportunities that were happening in my Uber. And they did a 2-page article. It was called the Kind-Hearted Driver article. And they just told some of the stories that have gone on in my Uber. And so I'm here today because I want to just let you know that in the months and years ahead, as you're trying to navigate these transportation issues, as specifically as it relates to rideshare, I'm available as a free resource. You can call on me if you have a question or if you need some ideas. I'm certainly at your disposal. And I'm collaborating with some groups that are addressing some of these issues. So I just want to make myself available. And I think that addressing not only transportation, but also loneliness, I think we really need to consider how do we put those things together and how do we be really intentional about addressing that. In closing, I would be remiss if I didn't bring up the fact of how did I become an Uber and a Lyft driver in the first place? Well, 2.5 years ago, the most important business innovation that I had come up with in my career, one that had been blocked by app stores for over 10 years, was actually taken from me by the state of Minnesota and rolled out in the COVID Aware MN app. And the governor's staff told me that they wouldn't compensate me for it. And to this day, they've refused to meet with me to talk about the new sector of strength that I can bring, I'm positioned to bring, to our state's economy. And the reason this matters and is relevant for this conversation is because if we're going to offer the same and even better services to our seniors and others, we're going to need to bring in new sectors of strength and new jobs that are good paying jobs that increase our tax base. And so, like I say, I would be remiss if I didn't say that's how I became an Uber and Lyft driver in the first place. I don't know where I'm going from here, but I did want to go on the record and just say I'm available as a resource, free of charge, if you ever have any questions.
Thank you. And I would make 2 comments to you. One, thank you for the work that you do as an Uber Lyft driver, and I hope the new legislation will be of help to you. Secondly, this whole piece about transportation needs being met and the loneliness piece. I know oftentimes when people get in a car with a taxi driver, especially if they're nervous, they will chat. And I just want to say thank you for listening and being compassionate, because it is important for people to have that human touch. So thank you. Wholly unrelated, for the last comment that you made, as chair of state and local government, I would encourage you to reach out to my LA, Jonah Westerman, make an appointment, and we can have that conversation separately. Sure. So but that's outside of the purview of this committee.
Sure, I get that, and I thank you for that.
But
and I would just say it's been my favorite job being a driver. I just love spending time with people. So we can do more of that as the state, I think.
Thank you. So I will look forward to 2 separate conversations. One, about your recommendations and thoughts with Andrew George and I on rideshare, and then the second one with Mr. Westerman and I on local and State Gov to talk about the other issue. That'd be great.
Thank you so much. I appreciate
Thank you.
it.
I appreciate that. Okay. Okay, our next presentation today on the agenda will be from, I just lost the Governor's Council on Age-Friendly Minnesota and AARP. I understand you're coming to the table together, is that correct, or no? Separately. Okay, so then we will have Jim Scheibel first with AARP, Minnesota Volunteer State President. Thank you, and when you're ready, if you'll state your name for the record, just bring it as close to yourself as possible.
Is this good?
That's perfect.
Okay.
If you'll begin your testimony, please.
Good morning, Chair Claiborne, members of the committee. I am Jim Scheibel. I'm the Volunteer State President of Minnesota AARP. I'm the former mayor of this capital city, always welcome, and the former national director of the Senior Corps. On behalf of our 620,000 members, and you notice some red here today, hope you saw a lot of that red throughout the session. We appreciate the opportunity to testify today. We want to thank you for your leadership in establishing this task force to address aging issues and the demographic changes in our state and nation. Today, we are pleased to be joined by the Governor's Council on Age Friendly, who will share an update of their work. Our counties, our cities, towns, and neighborhoods are the foundation of our high quality of life that we strive for and have obtained. Our citizens age 50 plus are a valuable asset and play a fundamental role in building and creating our communities. This morning, I will share with you some of the background of the AARP network of age-friendly states and communities and share with you some recommendations. By the way of background, AARP is the national affiliate of the World Health Organization Age-Friendly Network to support the work of local, regional, and state governments as they prepare for the nation's changing demographics. Established in 2012, the network is committed to build more livable communities of people of all ages with a focus on older adults. Enrolling in the network requires a letter of commitment signed by the jurisdiction's highest elected officials. Once enrolled in the program, it requires a governing structure to include older residents, a community needs assessment, and an action and an evaluation plan based on assessment. This is a continual process, and AARP helps shares resources, the best practices among the network. As a social mission organization, we advocate for funding but do not accept state or federal money. Today, we have 23 age-friendly communities enrolled in the network, representing 30% of the population, plus the state of Minnesota, which enrolled in 2022. Let me share with you a few examples of the work they've done with a focus on cross-collaboration. Maple Grove partnered with T-Mobile to provide tablets and training for residents to remain connected at home. The partnership has proved essential in addressing social isolation. Leaders in Northville heard concerns from residents who were unable to connect with their healthcare providers and created and distributed a telemedicine guide to encourage and educate residents to visit their providers remotely. Lake County is focused on home assessment and modifications throughout the county. And Finland, a town within the county, has grassroots initiative to develop affordable and accessible intergenerational housing. And finally, Princeton created a community center without walls to address social isolation. All these initiatives address gaps identified locally. At the state level, the action plan is under development through the multi-sector blueprint on aging. By design, the Governor's Council on Age Friendly was created. It brought together voices of state agencies, tribal communities, older Minnesotans to build bridges across departments working together to break down silos and find solutions to help other Minnesotans. And the state grant program is helping spur innovation at the local level. As the council embarks on creating its action plan through the multi-sector blueprint for aging, AARP recommends some policy changes. We urge your consideration of them. 1, the enactment of a permanent age-friendly council. Without legislative action, this council will sunset in 2027. It's critical to continue the work to develop a roadmap for making progress towards our goals and is grounded in the voices of Minnesotans. 2, ensure economic vitality of older Minnesotans. The historic passage of both the paid family leave and secure choice retirement program last year will provide family caregivers and workers without retirement plan much-needed economic security. Our job now will be to ensure a successful implementation. 3, improve timely access to home and community-based services. Today, older adults who need long-term care under Medicaid may have to wait sometimes up to 90 days to establish eligibility, which funnels many families into nursing homes. 4th, create more affordable housing options. In Minnesota, the number of older adults turning 65 in this decade will be greater than in the past decades combined, undoubtedly impacting housing needs. AARP supports efforts to expand affordable housing options by easing barriers to construction and providing cities and towns with incentives and support, including tax incentives. And 5th, ensure equitable access to high-speed internet. Technology is essential in ensuring older Americans can participate in society, but disparities in broadband access, digital literacy, and comfort using technology exists. In conclusion, we are excited about the work that is happening to create opportunities for residents of all ages, including older adults, to participate in community life. We want to thank you again for your time today and your leadership in addressing these important aging issues. I will now turn it over to our age-friendly council, Rena Shetty.
Thank you very much for your presentation today. I appreciate it. Thanks for your come up.
Good morning.
I had my microphone off. Good morning, Chair Pugh. It's great to have you with us this morning.
Thank you. Good morning. I can't move my seat here.
That's good. I think you're getting some assistance.
Good morning to the committee members and chair.
And if you'll pull the microphone forward too, that would be wonderful. Thank you. When you're ready, if you'll state your name for the record and begin your testimony, please.
Okay. Well, I'm Sherry Pugh, Chair of Age Friendly Minnesota. And today with me is Rena Shetty, our director, who's currently serving as acting director of the Board on Aging, and our acting director, Kirsten Olson. Where's Kirsten? There she is. Okay, Kirsten Olson. So Rena's going to start.
Are we, right, we're just solving a technology issue with the presentation. So if you can all please be patient for just one moment.
Well, while we're waiting, I'll tell you a story. My banker in Mound, Glory, who greets me every day when I come in the bank and says, "Hi, Sherry," which I love, is retiring today. And she is retiring. I said, "What are you going to do?" And she said, "Well, we've built a house in Aiken, and we're retiring there." And I said, "Aiken?" I said, "Do you know that's the fastest growing community for aging persons?" And she said, "Oh, yes, my daughter told us that." And so I was able to say to her, and guess what? Age Friendly gave a grant to Aiken to create a public park area for its aging community. So there's always connections that we see across the state with this program. So have I used up enough time? Do I need to tell another story?
Was that grant one of the grants that was funded through the state grant program?
Yes, it was funded in this first grant round.
Thank you.
Yeah.
Okay, you heard that?
Yeah. Okay, I think we're ready now.
So then, I'll just, yeah, I don't think that he probably has the other website though, but. Okay.
Let's go ahead and begin the presentation, and as we work on the technology, and we'll catch up with the
Sounds good.
presentation slides.
Thank you, Madam Chair, members of the committee. My name is Reena Shetty, and I'm the Interim Director for Aging and Adult Services Division at DHS. I would like to start with recommendations. Next slide, please.
And that, do you have the printed slides?
Yes.
We can begin with just the printed slides.
Okay. I would like to start with the recommendations that we would like to make to the Task Force on Aging. We hope that the presentation will validate these recommendations. In sequential order, the first recommendation is to make permanent the Age-Friendly Minnesota Council. This entity serves as a backbone for coordination and planning to address demographic shifts in communities across Minnesota. Second recommendation is to mobilize the council's current cross-agency, multi-sector work as the task force looks to develop a new infrastructure around aging. And the final recommendation is to adopt the multi-sector blueprint priorities developed by the Age-Friendly Minnesota Council. Why age-friendly? In 2023, at the first session of the Legislative Task Force on Aging, Madam Chair, you commented on the good, solid infrastructure that Minnesota has that has led to us being a leader. At that same session, you indicated that we should amplify the things that are working well in the state. I'm here to emphasize this, especially after hearing Pennsylvania Department on Aging's presentation. Aging as a concept is evolving. We are living longer, but our systems weren't designed for modern aging. The age-friendly paradigm reflects an updated, holistic approach to how our systems and communities can include and integrate aging at a new level. We understand aging as something to be valued and as a universal experience. Next slide, which is the one that has Minnesota as being well-positioned for success, if you're following the paper slides. Minnesota is uniquely positioned with a very strong foundation for age-friendly work. While most states just have one or two pieces of this work, Minnesota's structure has three major components. First, a governor's executive order that provides the mandate and leadership. Second, legislature that has funded this initiative. And third, state agency that provides staffing and administrative support. Jumping to the timeline. In less than 5 years, the council has operationalized many aspects of the recommendations that were made to the governor. But how did this all begin? In 2020, on what turned out to be the cusp of the pandemic, Lieutenant Governor Flanagan offered opening remarks at the council's first meeting, after which the council did its inaugural work during the pandemic and drafted recommendations to the governor later that year. As the 10th state to join the AARP network of age-friendly states and communities, we are part of not only a national and global movement, but also part of a broader ecosystem of age-friendly work. And that ecosystem includes age-friendly universities, health systems, public health, and so on. I'm going to jump now to who makes up the council. The council is made up of members representing 9 state agencies and representation from age-friendly communities, academic partnerships, faith communities, and tribal nation. The structure of the council is designed to facilitate coordination among state agencies, communities around Minnesota, and deeper integration of aging across our systems. The next slide, in terms of just highlighting some of the major work of the council. Just as critical as the coordination piece is the council's commitment to reframe aging, which is necessary to truly create better plans and policies around aging. Aging is an all of us issue, not just a them issue. Words and language matters, and if we don't recognize that, these biases show up in policy and funding decisions. In a little bit, Kirsten Olson, to my left, will speak on the multi-sector blueprint on aging, and Sherry Pugh, who you've heard on the story about Aiken, will highlight the grant efforts. But I want to close my portion of the slides just highlighting opportunities and innovations. I think this was talked about with the Pennsylvania Department on Aging, but also through various comments. But the council has developed research briefs on housing, age-friendly housing. And last fall, I had the opportunity to speak with Councilwoman Armstrong and really was trying to understand the coordination of age-friendly with tribal nations. And as a result of that, we've developed a research brief on that work as well. And oftentimes we'll find that these briefs showcase that it's not just funding that's needed. Resource aside, really we need a shift in policies and collaboration across sectors. So that's one of the innovation pieces that I'd like to highlight. The other opportunity is, as part of the multi-sector blueprint work, there's some real opportunities to consider joint proposals across sectors as we think about the 2025 legislative session. And this work really cuts across sectors. And finally, again, the Pennsylvania Department on Aging mentioned this in terms of their work. One of the challenges in terms of working with their Department of Health, we, Age-Friendly, along with the Minnesota Department of Health, we've started mapping out our healthy aging programs and initiatives to really assess and analyze the landscape of aging programs. So in short, the council has embarked on a lot of these innovative strategies and cross-sector work. With that, I will hand it over to Kirsten.
Okay, thank you. So again, my name is Kirsten Olson, and I am the Interim Director for the Age-Friendly Council. If you're following along, we'll start out on the multi-sector plan on aging slide. So Minnesota, through the Governor's Council for an Age-Friendly Minnesota, is creating a multi-sector plan on aging, a collaborative plan that will guide us over the next 10 years, meeting challenges as well as harnessing opportunities of our changing demographics. Minnesota's Blueprint for Aging looks to both traditional partners as well as non-traditional partners to be active participants in aging work. It aims to bring aging into the mainstream, putting a lifespan lens on all facets of community life and moving towards the elimination of health, economic, and social inequities in our state. Next slide. So this slide shows a map of the United States. And on the map, there are three colors, red, light blue, and dark blue. And these are indicators of states in which there's national momentum around multi-sector plans on aging. Approximately half of the United States has either begun creating, developing, or implementing their own multi-sector plans. Next slide. Minnesota took part in a year-long multi-state collaborative for peer learning with 9 other states at similar stages of multi-sector planning. In addition to what's listed on this slide, which includes mechanisms for engaging non-traditional partners in the states to develop systems-based solutions, building on existing coordination of state agencies through the Age-Friendly Council, and strengthening our participation through the year-long multi-state collaborative. It's important to note that Minnesota's work included statewide community needs assessments, as well as 7 regional conversations to gather insight and ideas from community members, as well as partners and subject matter experts. With this, we built the framework for Minnesota's multi-sector blueprint on aging. Next slide. And this slide, titled Blueprint Domains and Strategies, is our framework for the blueprint. Again, to reference Pennsylvania, who presented earlier, they had 5 different areas in which their blueprint work, their multi-sector aging work was being done. In Minnesota, we have 4: connected communities, emergency preparedness, individual rights and safety, optimized health and longevity, and economic security and vitality. As much of our work occurred in the immediate aftermath of the pandemic, we innately understood that the blueprint could not and should not be highly prescriptive. It had to be created to be nimble and flexible to address shifting priorities, particularly in times of crisis. These overarching domains, which form the Minnesota Blueprint, are what Age-Friendly recommends as the lens through which to organize task force recommendations. The domains recognize the interconnections between areas such as affordable housing, multimodal transportation, and social engagement. It encompasses not only the social determinants of health, but also the World Health Organization and AARP domains of livability, and provides a framework to act through an aging lens. If you have the slide in front of you, you'll see that under the 4 primary domains, there are strategic areas. Within this framework, state agencies and other partners identify and lead specific and measurable tactics, actions to reach interrelated goals. The blueprint addresses lessons learned with a focus both on emergency preparedness and response, as well as identifying current pressing needs, affordable housing, healthcare, and workforce, and looking to the future for affordability of aging and longevity. The blueprint, which will be released later this year, recognizes the importance of reframing aging. It's a roadmap showing how, in a coordinated manner, through the tactics of partner organizations, we can build new and improved systems that provide us all with equitable opportunities to age well. Next slide, the blueprint collaborations. This slide really shows how we have our traditional aging partners that we work with as well as council members. We also have partnerships in development with state agencies such as Department of Corrections and Department of Natural Resources, parts of the age-friendly ecosystem, the age-friendly universities and health systems, and we work with non-traditional partners such as banks, faith communities, community colleges, civic organizations, and culturally specific service providers. Aging doesn't happen in a vacuum. It is universal. And through the blueprint, we will more fully integrate new agencies, players, and sectors with our traditional partners, such as the Minnesota Board on Aging and area agencies on aging. Unfortunately, with the technical difficulties, we wanted to show you our newly launched blueprint. So if you are able to go to www.agefriendlymn.org/blueprint sometime after this presentation, you'll be able to walk through the blueprint yourself. This site, just launched this week, is a storyboard that showcases the vision and the structure of our blueprint, along with key data points and other valuable content. And finally, just to note, at its core, our blueprint is data-driven. We use data to develop and eventually to monitor the blueprint progress. We're currently finishing up our first stage in terms of research, and we're continuing to review data from a number of sources, including census reports, the Minnesota Demographer's Office, the Minnesota Homeless Study, and many, many others. This summer, we'll shift into our phase 2, working with subject matter experts and partners to develop metrics to measure the blueprint tactics and objectives that will appear, and set a schedule for analyzing progress towards our ultimate goals.
Excuse me, someone online is not muted. So if you could please check and make sure that you're muted online, I would appreciate it. Thank you. We're just getting some feedback.
The blueprint is to help transform our state so that we can all live well and age well. Now I'd like to turn the platform over to our chair, Sherry Pugh. Minnesota's blueprint is only part of the Age-Friendly Council story. And Chair Pugh will speak with you about our Age-Friendly Grants program, helping cities, counties, communities, and organizations across the state bring innovative, age-friendly projects to life.
So in addition to the master multi-sector blueprint, Age-Friendly Council has focused on providing resources to Minnesotans which will enable communities to imagine, develop, and lead aging and age-friendly activities and efforts. On the first slide, if you're looking at it, where it talks about grants overview, with a relatively small amount of money, just over $1 million, we've been able to impact and elevate aging and age-friendly work and provided opportunities to activate age-friendly work throughout the state. 90 community grants to cities, communities, school districts, universities, foundations, nonprofit organizations, and others were provided. Innovative structure. We had 9 technical assistance providers, we call our TAP grantees, to help less experienced organizations, apply for and administer their grants. So what we did in this innovation is we recognized that many of our communities may have never applied for a grant. There was a community of 200 people. They had never applied for a grant before. Our TAP consultants were able to then help them write the grant, help them in doing their reporting and setting up their structures. And we also made efforts to simplify the grant form. Although it's lengthy, people say, well, it's, 15 pages long? Mm-hmm. But it does everything a group needs to have done, so it doesn't leave anything out. So we wanted to really make that accessible. We had an equity focus. 20 grants are to culturally specific groups, many grants to rural communities, and diverse array of projects supporting systems, environments, program development, but we did not fund any direct services with this money. It is the grants program is a very strong element of this program is to not be prescriptive. So when we asked for people to submit grants, we said, tell us what you need to do in your community And the only prescription was we weren't going to fund services. So communities told us everything they wanted to do, from building pickleball courts to correcting ADA deficiencies in buildings they had, to creating programs, doing intergenerational work with their school districts, and many other things. Specific is, examples for you would be CARE Resources Connection. It's a metro group. They connected fire departments with older adults following 911 calls to ensure that individuals connected to the right resource and better outcomes. And another one was Wilmer, the city of Wilmer, and I'll talk a little bit more about both of these. In West Central Minnesota, where we gave them a grant to conduct a community needs assessment related to aging and specific focus on the growing Hispanic and Latino populations in their community. The age-friendly grant cycle is, the current one is coming to a close, but we've given some of those grantees an opportunity to ask for an extension. In other words, they're coming to the close of this first grant, but they still have some work to do on their efforts, and so we are able to afford them some additional funding to do that. But there will be grants available for new grantees sometime in July, we're hoping, right? And everything. So we had these partnerships, and I want to talk a little bit more about CARE, because it's nonprofits. Partners were around public safety, and, you know, we have emergency preparedness. And I know this year in the legislative session, you had the EMS bill, which, and I'm a city council member in my town, which, you know, has become a major issue for many cities because, you know, in Mound, where I live, we have a volunteer fire department. So when someone calls 911, all of the volunteers are alerted, you know, to see who can come in to respond. So we have one call, but there's 49 outreach calls to the fire department. And then you get 4 of them to come. They get in a truck and they go to that house. Now, also, the police department's sending a person, and who else? An ambulance may come. So you've got 3 agencies responding. You know, in our case, 49 people contacted, and it's often for falls. And so we need to figure out, one, how do we cover that cost, which is an expensive cost, but how do we make that system more efficient? And so we're hopeful that some of the work of this grantee will help us in really trying to figure out how can we best be responsive, but yet also manage our cost. And I think Senator Smith is also working on a bill at the national level on this thing. So the group is working also with Normandale College to create an internship program for community healthcare workers. So that's one possible step in addressing it. And also to develop critically inclusive discharge plans for people without family support at home. So those are things that we're hopeful to see come out of this one grant that we funded. In Wilmer, the intentional work is to create an open and inclusive community conversation focusing on the development of strong connections with the Hispanic, Somali, and Karen communities. They've had an increased immigration, or not immigration, but an increase in new immigrants coming into their community. And this gives them that opportunity to talk with that community and the greater community in reaching their goals. And so they'll be developing surveys, a needs assessment, they'll be doing listening sessions as such, engaged in a series of community conversations with cross sections of the Hispanic, Somali, and Karen communities in Wilmer. So this is something that hasn't been done before, and we're glad that we're part of helping them move forward on that. Our next slide is one that shows the state and the community grants. And while, I'm sure that there's some community that can say, you didn't get us, or you could do better. Yes, we can always do better. But we do feel that for a first time out grant, and that we worked really hard to get distribution of resources throughout the state. And so you can see that in Northeast Minnesota, there were 13 projects funded, 420,000. In Northwest, there were 11 projects for 288,000. Southwest, 12 projects for 335,000. And the Metro, there were 35 projects, 917. Southeast Minnesota, 6 projects, 195,000. So we hope to continue to do better and get more resources out there, but we do feel like we've got a good feel. We've got a touch out there, and we're encouraging people and asking everyone here today to encourage people to come with whatever their thoughts are. There were a wide variety. We funded a labyrinth over in West St. Paul. And we funded rickshaws in Alexandria. And then this one little school district got a grant, and their grant is that they're taking every student in their small school district and they're creating intergenerational connections with the seniors in their community. How wonderful is that? So see, even in the smallest communities, there's something that is unique that works best for that community. Again, just want to remind you, this is our first grant cycle. We'll be reporting out from the outcomes of it, but the second grant cycle will be announced in July, and people can apply. And I guess I would end with saying, again, our recommendations in our work thus far is to make the age-friendly Minnesota Council, which we do sunset in 2025, if nothing's done, to leverage council's cross-agency, multi-sector planning and coordination as a new infrastructure around aging. We feel that we've got some of the best of partnerships and connections to continue this work, and to adopt a multi-sector blueprint, domains, and strategies as a framework the task force recommendations. With that, I end. Thank you.
Thank you, Chair Pugh. Are there any other comments from the previous? Not all of them are questions.
Okay.
Do we have any online questions? Thank you. I forgot to turn on my speaker. Next, we'll move to questions by the task force or conversation by the task force. Is there anyone online who would like to? I see Dr. Gogler has his hand up. Dr. Gogler?
Yep. Yes, hi, thank you for the great work, all of the engagement and your presentation today. The one question I have, if I overheard the presentation, was that you said, did I hear correctly, your blueprint report will not be out till the end of the year?
Interim Director?
Thank you very much. The blueprint, the framework for the blueprint should be out at the end of the summer. Right now, a draft has been released, so a draft is currently available online. But we do need to bring the blueprint before the council for approval, and so we expect to release the actual blueprint later on this year.
Yeah, no, that's helpful. The reason why I asked this question is, based on some of our conversations at the last task force meeting and suggestions, if we do indeed wish to align our recommendation report with, say, for example, the model that the Age-Friendly Council uses, it would be probably wise to align the timelines as well. With our report, again, Chair, remind me, I believe it's January 2025 it's due, correct?
That is correct.
Yes. So, I mean, ensuring that if our task force makes that decision, that we have the best, most up-to-date version of your report available so it can help inform our work too. I mean, I think, again, a theme that I believe many of us agree on is the need for as great alignment and integration as possible, and this would be one example of that.
Thank you, Dr. Gogler. Any response to that? I think it would be very helpful if you would just send us, to the members of the task force, just the hard draft that you have now. I went online and frankly, I found the website to be very confusing and very difficult for me to navigate. You know,
Thank you, Chair, as did I.
You did.
Thank you for saying that.
That's good to know. Yeah.
You know, I think sometimes, as many of you know, I'm a mediator by profession, and I always say the person who should put the signs up at the airport is the person who doesn't know the airport, right? And I think it's very clear that a lot of work has been done, but the navigation of this has clearly been done by someone who knows knows the outcome. We don't know the outcome, so it's very hard for us to navigate this. So that's just one piece of feedback. Okay.
Well, that's critical input that we need early on.
Yeah.
Yes.
So if you can have somebody who doesn't know anything about your work, look at this and say, okay, where do I find this? That would be, I think, helpful. Dr. Gogler, did you have anything else you wanted to add?
No, thank you, Chair. That was a great point that you made. You know, one thing I was half expecting when looking at the website was, you know, it's been alluded to multiple times, the different pillars of the age-friendly model that you're relying on. You say it encompasses social determinants of health, et cetera. You know, those are the kinds of things I think that would be really helpful for our task force as we continue to revise our recommendations. And again, just having it available to inform our work would be important. So
Thank you.
thank you so much.
Ms. Schneider, did you have a question, a comment?
Yes, thank you, Madam Chair, and thank you, folks, for the presentation. A couple of things that I wanted to mention. First of all, I really applaud you on the technical assistance piece that you have provided to potential grantees. I think you know that I've been in aging for close to 35 years, so I've seen the gamut of grant offerings. I've also talked to many, many organizations who were interested in applying, but they did not have a clue as to where to start. And I ended up being their technical assistance person, which is fine until it gets too big to handle. And so when you begin to think ahead of, here's some technical assistance for first-timers, it's a tremendous benefit. So I really applaud that. The second thing I wanted to say is last fall, we had our annual outstate meeting at Alexandria, Minnesota. And we heard from the Douglas County Habitat for Humanity on their program for aging in place. It was a remodel program. It could involve things like ramps, et cetera. I loved hearing about that because I understand the gravity and the sheer size of our housing challenges in Minnesota, especially for older adults. And here we were taking that practical look at what can we do to help people remain in the home that they love and have known and enjoyed for 50 years. So that's another good step, I think, in getting reality-based in terms of how we move forward. And then the last thing I wanted to say is, I see we've included economic development agencies within the list of non-traditional partners. Keep that in mind. I'm in one of my other roles, I'm an economic development commissioner, and we work really hard to attract new businesses and new innovations. And we get them to the place where they want to come into the city or they want to come into the region. And the next question is, where can we house the families of the professionals who are going to be coming here, earning decent salaries, increasing the tax base? And we have to say, we don't have it. And the reason we don't have it is because seniors hold on to these 4 or 5 bedroom homes longer than they really want to, but they don't have an option. And so when you start to think about freeing up that housing circle so that the young families can live in the houses where seniors have raised their families, and elders can live in more elder-friendly homes, affordable, I might add, we have really accomplished something. So thank you for the work. I like the blueprint a lot. I know it's a work in progress, but I'm going to grab Kirsten's description, nimble. Thank you.
Okay, are there any other further questions before I ask mine? Okay, so I'm a little harder because I wear different hats, right? So as the lead for the Task Force on Aging, I appreciate and value the work that you're doing to make Minnesota more age-friendly. I appreciate that. I really liked, so when I looked at the enabling executive orders from Pennsylvania and Minnesota, when you read the wording, to your point that words matter, I would really encourage you to look at that enabling executive order from Pennsylvania, because it truly was people-focused. And the word opportunity was written so many times. And it's about providing opportunity for longevity, opportunity for participation, opportunity for continued vibrancy. And I really, really liked the way it was done. So if you're focusing your work, and when I read the Minnesota executive order, it was really more about caretaking, right? How do we care for our aged as opposed to our older Minnesotans, as opposed to how do we provide opportunities throughout the life cycle? And I think there's a big difference in those two statements. And this is just my interpretation. So when we're looking at this blueprint, I think opening up the opportunities, right? And not focusing solely on how do we provide care, right? I think that's really important. Now, I'm going to take off my task force chairmanship and put on my state gov chairmanship. And Rena, I really appreciate your coming and talking to me on numerous occasions. When I looked at the legislation that was coming forward this year, I was very much disappointed, because when I would ask, how is aging factoring into the housing bills that were moving forward? They were pitting affordability against accessibility. So the things that we would need for accessibility were being cut for affordability. It's not an either or, it's an and. And we have to figure out, how do we do this together? When looking at the strategic visions for the agencies, aging is not there. This is, to me, if we're talking about collaboration and building and breaking down silos, we must say, where is that strategic vision for aging in all of the strategic plans for every agency in the state? And I'm going to look to you to say, where is that, right? How did this get missed? We are already behind. So that advocacy has to be there. And the demand for that aging has to be there. And I don't know exactly how we do that. And I'm looking for your leadership there. If this is the mission that you are saying that you're doing, then we need to figure that out. As far, I think the grants that you have provided are good grants. I think there's a good space for that. But if you could please tell me, how are you measuring with data the impact of these grants? I don't know if someone can answer that.
Madam Chair and members, I'll take the question on strategic vision for aging, and hoping someone else will take the aging, the grants outcomes. The multi-sector blueprint on aging is, the expectation is that strategic visions on aging across state agencies are under the multi-sector blueprint. So as an example, our partners at Commerce, and I'll just say the Energy Assistance Program, they develop a state plan that they submit to their federal partners, the Department of Energy, and older adults, people with disabilities are part of that state plan. So what the multi-sector blueprint is intended to do is pull in the strategic visions across different state agencies under one umbrella plan. And so that is the the short-term and the long-term goal is to pull in strategic visions on aging across different sectors into the blueprint on aging.
Okay, so forgive me, I'm just going to push back a little bit. When looking at the Pennsylvania plan, right, it starts big overarching, then it goes to strategy, and then it goes to tactics, right? I'm not seeing that in our work. And help me if I'm missing it.
Kirsten, do you want to take that?
Sure, sure. And so, no, you're not missing it because the framework, what has been released in terms of the draft at this point is it's the domains and the strategies. So the objectives, so we do the same thing. It goes domains, strategies, objectives, so kind of the general goals, and then the tactics. And that's the place that we are right now in terms of the last slide in the last slide in that section was about kind of the data and the measuring. So we're entering phase 2. We have collected and we end collecting our tactics approximately July 1st. Right now, we have a couple hundred. And so we have received these tactics from many, many different partner organizations. So over the summer, the intent is to narrow, it's to winnow, it's to have facilitated discussions with those who are going to be leading those tactics, because each one of the tactics will have a lead within potentially agencies. It could be a philanthropic partner, it could be a economic partner, but a partner to lead those pieces. And then those are the tactics that form the plan moving forward. So that it's just that we are not quite there yet. We're at the phase of identifying tactics and then leading them, identifying leaders.
Okay, and I have said this numerous times, and no one will be surprised to hear me say this. When I have asked for identification of gaps, it's been like crickets from the agencies. And I understand that it's a difficult thing to do, because if you know there's a gap, then why aren't you doing it? And I understand that the financial resources to do it may be the limitation, right? But how are we going to address the conflict of interest that agencies have, partnerships have, private entities have in putting together this Minnesota framework, right? Because if your paycheck is dependent on you doing X, then you're going to do X, right? So I really want us to push the agencies to get outside of their comfort zone and to help us identify where those gaps are so that we can truly address them. And I realize it's very, very hard as an agency head to get out above your skis, in front of your skis, but we have to identify those gaps. And I think by doing the people-centered conversations that Pennsylvania has done, it's the people who are saying, these are the gaps, right? This is what we need, both for vibrancy and for care. And I think we have to rely more heavily on Minnesotans than for the people who have either a financial interest or a promotional interest in having that out there, or even the agency heads. I mean, we have to be able to keep it, this is what the people are experiencing, and this is where we have to drive this conversation, right? Let's see, I'm gonna see if I have another. Let's see. And we've talked about the transportation being a key issue. And when I'm thinking about our long-term care, right? In the legislative process this year, we heard a lot from the care providers, and that's really important. But we also need to make sure that we're balancing the needs of the care providers with the needs of our families and making sure that the family's voice is there, right? If we know what the needs that our families have, right, then we can help our care providers in a different way. And to make sure that the dollars, because I can only spend $1 once, right? And I have to make sure that when I'm allocating that dollar through the legislative budget, that we know that it's really going to serve the people of Minnesota and to make sure that their needs are met, right? Because we can have care facilities, but if our families can't afford them, it's not helpful, right? And when we're looking at home and community-based services, and this goes back to the strategic plan, right? I don't see where that, home and community-based services is going to be a budget buster going forward if we don't get these early line services, upstream services put into place and being able to identify them, as we heard both in Pennsylvania and I think as we've had in our conversations privately. So making sure that we're identifying those effective, and whether you do it in your tactics or if you do it in your overarching plan, but how do we identify those upstream and get those services into place first so that we can reduce this cost on the back end? I think it'll add high quality of life and independence, but also keep our budget within the parameters that we have. Maureen, did you want to say something? Yeah.
No, I just wanted to talk about something Representative Cleavorn had mentioned to me, just whispered to me about the metrics and the evaluation. And I was looking back over my notes, and so it sounds like the new dashboard, the new platform that you talked about, Kirsten, is that, am I understanding that right? That there would be some opportunity there for regular analysis and evaluation, progress, how are we doing?
Exactly. Yep, the data dashboard, which is kind of part of this phase 2 work of the blueprint work, is going to be our metrics. So we'll be able to look at that, and then again, with the blueprint being a 10-year plan, the idea is we're looking at it frequently. We initially identify the metrics, and then with that idea of being able to determine, are the projects working? Are there places that they need changes? Then at the 2-year mark, at the 5-year mark, and if it just incrementally, we're going to be able to see what the progress is, what the progress is not, and how to make those changes to ensure that we are moving beyond the tactic level to those ultimate outcomes.
Thank you. Could I ask her one more question?
Please go ahead.
With your present grantees, have you already begun to catalog within the database what they've told you in their progress reports, et cetera, et cetera? So you already have a pulse beat on how they're doing?
Yes, we have. I mean, again, our first grant cycle is just ending.
Right.
So those grants ended as of March 31st. So we have data, we have most of the first initial progress reports, but then more will come in because there were some extensions until June. So yes, we're starting that process, and we have the final progress reports on many of the grantees.
I always worry that a grantee would not want to put any future funding in jeopardy, so they might not report some of the more negatives. I'm hoping they can always be encouraged to tell us what's working and what's not working.
Yeah, and I will say, we have definitely been having those conversations with grantees. We've been having very close conversations with them, so.
Thank you.
So I just want to be clear. So I'm looking at the impact statement on the website for agefriendlyminnesota.org, and it tells me what you've done, but it doesn't show me, I don't see any metrics there about and you're saying that's coming later?
Yes, I mean, well.
Yeah. I'm not trying to be hard, I'm just trying to understand where those metrics are.
The metrics, I think she's talking about the blueprint metrics.
That you're talking about the data dashboard, the metric, so.
This
so
says 2023 grantees, and it says grant updates. You've got one that says impact, and then you've got one it's under different tabs. So that's why I said this website is hard to navigate, because it's really hard for me to understand where I should go to look for what.
And so, no, that information is not online right now. That's part of the phase 2. So
Okay.
we're still in the data collection phase. We're moving into that phase 2.
Okay.
Madam Chair, I have my hand up online if I can ask a question.
Oh,
I don't know
yes,
if you all
please,
saw.
Please do. Go ahead,
I'm
Dr.
sorry.
Gogler.
I didn't mean to interrupt, Madam
That's
Chair. Just have two quick questions, because I actually have to jump off here.
Yeah, and we're going to close soon.
Yeah, really briefly, I'll just give my overall impression of age-friendly initiative in general. This is not reflective of what's going on in Minnesota and all the great work here, but one of the challenges, I think, Madam Chair, to me, I think you're really getting at the essence of one of the challenges with the whole age-friendly movement is the concept itself in terms of how it's operationalized, and when I use that term in terms of how it's measured, and then more specifically, the impacts, the outcomes, that to me is the big challenge in all the age-friendly work. Much of it is process-based in terms of activity and engagement, and you should do X, Y, and Z, but taking it to that next step of, by doing this, we are actually impacting outcome X, Y, Z, to me is the next step that all of this work can and hopefully will be taking, because that's pretty critical to, I think, the work we're doing as the task force in terms of our recommendations. The last thing I have is a question for the task force and you, Madam Chair, as well as Andrew. I haven't had a chance to read through the draft report that Andrew was kind enough to put together. Would it be helpful if I or perhaps others, task force members, reviewed it to provide feedback now? Or would you prefer to hold off on that?
Oh, no, public input on that draft, task force member input on that draft, as soon as you can get us your thoughts, we would be happy to, because I would like to be able to put those comments forward, have that discussion in public. I would like that draft to be very transparent. So no.
Right, so,
Yes.
okay, thank you, Madam Chair. So Andrew, Madam Chair, I'll start reviewing it in depth and I'll give all that feedback. Thank you, everybody.
That would be perfect, and I would ask the public for their comments as well, because this work is truly intended to be public work, and we need your input in order to do that. And so I think I will close for now, and I will say thank you to the three of you for the great work that you're doing and for the heartfelt work that you're doing. I know that you're trying to move our state in the best direction possible to make Minnesota a place where everyone can grow and thrive. So I want to thank you for that. With that, members, I think, did you have anything else? All right, we are planning, I'm going to ask everyone to watch the Legislative Coordinating Commission's website for the Legislative Task Force on Aging. We are planning 2 meetings for the month of June. And so we're going to want to make sure that awareness is out there, as the same task that you have. Getting the information out is always a difficult thing to do. So please watch that website, share that website. Mr. Heller, I see you have your hand up. Is there something you wanted to say to us? If you could please make room for Mr. Heller at the dais, that would be wonderful. Thank you. And then we will adjourn as soon as Mr. Heller is finished. If you would please state your name for the record, Mr. Heller, and then provide your comments.
Yes, my name is Rick Heller. Unofficially represent the twice exceptional and people with print disabilities. You'll find this House File 3299, and then the other one for print disability, 5487.
I'm sorry, you said 5487?
5487.
Thank you.
I come to testify today about accessibility. I have reviewed your information. The legislature is going to do digital accessibility in Minnesota Statute 16E.03 Subdivision 9 in October. Is this database will be fully accessible? I know the Pennsylvania group don't apply web content accessibility guidelines after I thoroughly searched their webpage. I don't know why you're going there. If vulnerable adults are part of the print disabled people, you got to really carefully consider that, including the people that handouts today. AARP and May 31st, 2021 has accessibility statement. Their document is not fully accessible. They need to correct it, and so we submit it to this committee. As we move forward on digital accessibility for the public, including handouts, you all need to be on the same page. If the legislature is going to do it, you need to do it. I'm not going to go any further into this discussion. Right now, there's many things to talk about. The time has elapsed. I did provide a electronic document to be posted. I'd asked that it be posted and the record reflect who I unofficially represent and what I spoke about, not just who I am. I unofficially represent the twice exceptional print disabled, has to do with digital accessibility, this task force, and the responsibility of the LCC legislation commission that has some oversight on this. Apparently, the correspondence that is from Jim Melby that's at this meeting did not include that in that correspondence. Hopefully, he'll regenerate and I can resubmit it to the committee. And thank you for this time to testify on this issue. I've been up here for over 10 years, for over a decade, testifying on both the twice exceptional people with print disabilities. Thank you again for this opportunity to speak. And that's enough for tonight. Thank you.
Thank you so much, Mr. Heller. I always appreciate having your voice at the table. And with that, members, our work for today has concluded, and this meeting is adjourned.